Supervisor Scrivener, through the chair. Yes, so every healthcare professional that believes a person is a suspect case and is going to test that patient is required by law to notify public health about that pending test. When the results are returned, those results are required by law to be given to public health for notification of positive test results. So on the dashboard, there is a portion that talks about testing, and in particular, there's a category of pending test. It's important to note that those pending tests are mostly made up of likely negative results. So when a test is taken and a lab determines that they are negative, they are not required by law to tell public health about that negative test result. So then that suspect case, that pending case is what it's called, stays stagnant on the website. Unlike other counties, we actually post all that, and then we go after all the negative results. So we have employees that then call the doctor's office and say, hey, Zach Scrivener was in here today, how come I don't have a result? And they say, oh, he tested negative. Okay, great, thank you. It comes off the pending test. So that is pending test that we're waiting for. The far majority are negative results we have yet to be given information on.
So when you say they're required by law to notify us of a test and then of a positive, is this state law?
Yes, sir.
That requires this? And so we don't have an ability to compel them to notify us of a negative test other than just calling and asking.
Yes, sir.
And so in the interest of transparency, we've created what appears to be a larger backlog.
Right.
Would you
and
say?
There's no backlog. It's just, so there are some tests in that pending test that are recent tests that have been taken. So for example, if you went to your doctor yesterday, that's a pending test because we haven't had a result back yet. Most tests are received within 72 hours. At times there's delays because they want to take a second sample or something happened to the test, but most of those are negative with a smaller amount that are probably within that 72 hour.
Well, as we move forward with more testing sites,
Yes.
and more tests are going to be taken, more results are going to be pending, that number, obviously it's going to continue to grow.
Yes.
And so I'm looking to you to try and find a way to educate the public, because when the public sees that, I think a lot of folks are frustrated. They say, why are these tests taking so long?
Mm-hmm. Right.
And they're actually not, as
No.
far as getting results. It's just the difference between the results that we are unaware of that are negative, and
Yes.
then chasing that down
Yes.
with your staff time in order to do that. And so have you thought of any strategies how we might be able to address that, at least whether it's education or maybe some other way?
I think one of the easiest ways would be for us to put a small description of what that definition of that testing type is made up of on the website. That would be one way.
Okay. I'd encourage you to continue to work on that.